Hello, welcome to Finding the Right Fit, Therapists and Treatment Modalities. This is the promo edition of the introduction to FRUA's focus on treatment modalities. I'm Terry Mandeville, the Volunteer Educational Chair for FRUA. This slide shows an introduction to a 2-year projected focus on some of the treatment modalities related to families with children who were adopted internationally. The slide shows over this 2-year period, as well as directories, family focus articles, and connections with various advisors and experts, will cover the various treatment modalities in more detail. Whether you are a FRUA Inc. Facebook group user, or maybe you've contacted the information email and gotten phone or email one-to-one support on resources, issues, contacts, or maybe you've just browsed the FRUA website and gotten some information. Please consider supporting us or continuing your support by becoming a member or renewing your membership. FRUA provides international adoption support resources for families completed through adoption from all of the former Soviet republics and bloc countries. We are a 501c3 volunteer, nonprofit parent support organization completely run by volunteers. The dues, fees go towards things that organizations have costs for, like publishing the Family Focus and mailing out the Family Focus and other resources, website fees, accounting fees, and other fees. Also, a portion of the dues goes back to the local groups that are active to help them conduct some local activities. FRUA also has social media connections, orphan support, which now has been given over to the young adult group, who are working on raising funds, vetting and finding projects, and putting it all together. So we look forward to more of that in the future. FRUA also offers scholarships for young adults who were adopted from FRUA countries, and regular local gatherings in some areas, as well as resources to organize your own local gathering. So please join us. Click on this link and you can pay online or send in a check, but you can definitely register online. There's options. You can do it pay your dues yearly, or you can pay for a 3-year period, or you can do an automatic renewal. Thank you. So, just why are we concerned about mental health issues? There have been studies over the ages about orphans and adoptions and orphanages. Probably the most relevant have been the studies that have followed the children that were adopted from Romanian orphanages to Canada. Many of the conclusions and thoughts are things that we as adoptive parents really probably have known all along, but it helps to have some of it validated. Researchers at the University of Minnesota have determined that a disproportional percentage of children who were adopted are diagnosed with mental health issues. Adoption has a lifelong effect on the adopted child, the family, and the community. Many of our children who were adopted from institutions have suffered from a unique combination of issues that aren't there for children who were raised from birth and families. And these concerns, these issues are related to neglect, poor medical or mental health care, lack of nurturing, physical or sexual abuse, abandonment, grief and loss, prenatal stressors, and including prenatal drug use, prenatal exposure to toxins or pollutions, and of course, prenatal alcohol exposure, unknown histories and genetics of our children, inadequate education, and malnutrition, and other things. Studies have indicated that the longer a child has been institutionalized, the greater the potential for mental health and behavior problems. Many times these issues do not disappear with time. In fact, they may increase in frequency and/or severity, and that's really common and important to know. You may not see an issue until a kid hits adolescence. Sometimes these issues result in school suspensions, aggression in the home and/or school and/or community, criminal activity, sexual acting out, dysfunctional peer relationships, underachievement in things like reading, math, and science, and other things. So families that adopt children from institutions need to be prepared for the possibility of behavioral and mental health issues, not only when the kid first gets there, but throughout all stages of growth and development and into adulthood. And families need to know how and where and when to get support. So some of our kids arrive and they're united with us, and they have some issues, some problems that are, in the grand scheme of things, comparatively mild, and with nurturing parenting, probably some help from schools and or counselors, therapists, doctors, these issues kind of smooth out, and these kids kind of fit right into the mainstream after a little bit and become happy and productive members of society and family. Some of these kids arrive with pretty significant problems sometimes, or develop some along the way, but the problems respond to nurturing parenting, therapy, counseling, and after a while, these things are survivable, and the kid goes on to develop into a productive and happy adult. A large portion of our kids arrive with issues and or develop them later that are pretty significant and that are long-standing problems that require intervention of therapy, treatment, counseling, medications, and pretty much a lifelong kind of thing. These are a few of the issues that we have seen, and some more. By no means is this all of them, and of course some of these can be on a continuum, relatively minor and acceptable, to big time problem for the family, criminal behaviors, psychiatric problems, and it varies from kid to kid, situation to situation. When is behavior normal? The difference between normal and abnormal behavior may not be clear. It's usually a matter of degree, and it can differ from kid to kid. Sometimes parents overreact to a short-term change in behavior. At the other extreme, a parent may downplay a serious problem or seek a simple answer to a complex problem, when we all like that. Normal behavior depends on the child's individual level of development, as well as things like family temperament, norms, expectations, stresses, and tolerances. Many of our children grow up happy and healthy. Some issues are normal at various stages of development and run their course with normal parenting and nurturing. When is it time to seek help? Timely and proactive help from the right fit of a therapist or counselor can often prevent a small problem from becoming serious. Counseling can help determine which problems are the result of everyday life, which may be related to adoption issues, and what things need intervention and what things are normal. Many adoptive parents have successfully set up a family counseling plan before adopting and implemented it even before issues arise, and there's nothing wrong with that. It's very common for adoptive families to feel overwhelmed by issues that develop in their children. As these concerns are more evident, it becomes increasingly important to seek professional help to sort out the problems. And there's no age or stage or length of time home that limits when you can start therapy or counseling. Trust your gut. It's important. If you feel like there's a problem, investigate it. Get help. There are some issues that might indicate that it's time to seek help, or at least some advice over whether or not you need help. If their child is doing things that are harmful to their own or others' physical, emotional, or social well-being, if they're having frequent, intense mood swings, and of note, these behaviors, issues, we're not talking about one-time things. We're talking about frequent, repetitive things that are influencing the child and the family's happiness and ability to function. A decrease in energy over long term, a disinterest in good grooming and changing clothes and brushing teeth and bathing, difficulty getting along with peers, difficulty making and keeping friends, or an increase in difficulties at school, avoiding friends and family, difficulty with attention to task, physical pain without a defined cause, nightmares, night terrors, or difficulty getting to or staying asleep, overeating or a lack of appetite, destructive behaviors, substance abuse, or other behaviors that are forbidden by law or ethics or religion or social mores. Now, parents and siblings may also wish to seek help at some point, because living with some of these kids can cause a lot of stress. And some of this you're going to go, well, yeah, that's parenting, but we're talking about an excess, an issue that is keeping you from functioning and enjoying life to the extreme. May include things like loss of interest in activities you used to enjoy, difficulty concentrating, fatigue and feeling worn out. Yes, we all feel that with our new kids, but if it's excessive, you might want to look at some intervention. Difficulty sleeping, feelings of excessive guilt, feeling powerless, worthless, hopeless, a change in emotional levels, feeling overwhelmed and overly stressed, feeling resentful or angry, feeling alone or disconnected from family or friends, and intense sibling rivalry. A lot of times, families hesitate to get intervention. There's a lot of reasons for that. They might include fear that seeking help would indicate they're a failure, somehow incompetent parents, or a belief that they should be able to handle it on their own. Fear that the family will be judged or blamed for the problems, embarrassment, hesitancy to upset or anger the child, fear that the family will lose control over the situation, fear that their concerns will be dismissed or not believed, and that's a really common thing. Our kids frequently have one behavior at home and another complete behavior at school, and nobody understands that or sees that, and that's where a therapist that gets it is necessary. Belief that all that is needed is time, love, and nurturing to turn things around. Fear that the child will be labeled and so suffer discrimination, bullying, or other long-term consequences that we associate with labeling them with a diagnosis. Belief that many of the diagnoses are inappropriately overused fads. Fear that intervention will result in administration of medications that could harm our child or lead to addictive behavior. Denial or avoidance, like don't rock the boat, maybe the problem will disappear. Or feelings of overwhelming despair or hopelessness and just don't know where to go first. Well, some realities. First of all, asking for help is not a weakness, it is a strength. Adoption can be a healing experience for many children. A nurturing family with love and stability can help a child to reach their full potential. However, there are some things that a family just cannot fix on its own. Many behaviors have roots in the coping behaviors that your child had to develop to remain safe and sane in the institution. They're not the fault of you. They're not the fault of your child. Many mental health issues are primary neurological or a result of prenatal or early childhood influences like FASD. They are not the fault of you, and they are not the fault of your child. A diagnosis does not define a child. Our children are always unique individuals with unlimited abilities. Diagnoses are merely a way to hook into resources and communicate with professionals about the problems our children may have. Difficult behavioral or mental health issues do not negate the need for us to love our children unconditionally, to stay connected, to focus on the positive, to strive to communicate in ways they can understand, and to encourage them to share feelings and ask questions. And know, as a parent, there is no better person to help your child than you. You are the expert on your child. Even though there are a myriad of different types of therapy, different names, generally there are some goals that they all have in common. Most therapies or counselings or treatments have a goal of resolving inappropriate or bothering behaviors, thoughts, relationships, or other difficulties. Have the goal of enabling the client and family to understand and become aware of issues and ways of thinking that may be automatic but are inaccurate and harmful. The goal of enabling the child to achieve their full potential. A goal to alleviate or lessen pain, discomfort, discontent, or stress. Goal to develop appropriate and effective coping mechanisms. And a goal to develop self-confidence, relaxation, and clear thinking. Time elements vary greatly from therapy to therapy, therapist to therapist. Usually, there's no set length of treatment. It can range from one session to a few months to many years. The duration of therapy depends on a lot of different things. The treatment methods used, the goals of the kid and the family, the number of issues that needs to be dealt with, the severity of the symptoms, and the history of what other therapies have been tried before, what has gone on before. The most common model of therapy at this present time in history is intermittent therapy, where the client initially has a few sessions, like 1 to 10, and then comes back for tune-ups when needed. This could be every couple of week tune-up to every year, depending on the patient's own assessment of their needs. Cost is another thing that varies widely. Depends on the therapist's specialization, their education, experience, location, how in demand they are, and the growing rate in the area. Sometimes insurance covers some types of therapy and therapists. Maybe a copay, and it usually is limited in the number of sessions covered. Some therapists do not accept any insurance coverage. Some therapists charge on a sliding scale according to family income. And free or low-cost therapy might be available for people with limited income through local clinics, hospitals, and community agencies. Now, in looking over therapists from all over this year, in 2018, the average range of fee for therapy was between $65 a session and $250 a session. And there were some on either side of that. So what should you do if you suspect your child may be suffering from a mental health issue? If you're uncertain or worried, schedule an appointment with your primary healthcare practitioner as soon as you can. Now, when we say primary healthcare practitioner, ideally, actually, we're talking about the adoptive medicine pediatrician, if you have access to one. There are adoptive medicine clinics throughout the world, and because so many pediatricians lack the experience and the training to get adoption issues, to understand what might be an issue or what might not be an issue, it is really, really important to get the input of somebody who has that experience and who does get it. Your primary care provider can screen, refer for assessment or treatment, or reassure you that your child's behavior and mental health are within a normal range. If you determine that therapy would be useful, then you get to start reviewing therapists and modes of treatment that are a good fit for your child and family. There are a lot, as we said, a lot of types of therapists and counselors. What do we mean by type? There's no standard definition. Mental health professionals can have different treatments, services, focuses, trainings, credentials, licenses. Type may refer to the type of therapy practiced or methods used, can refer to the degrees or licenses or credentials that they hold, or what they've been trained in. can refer to the issues or types of clients that they specialize in. It can refer to what age group of client that they work with, or whether they work with individuals, groups, families, or a combination. It can refer to the settings where the therapy is offered, in an office, in an institution, at home, over the internet. Educational material for FRUA members will provide some more complete information on many of the various types of therapists. How do you find a good fit? Well, it can be hard. Finding a therapist who has therapeutic skills as well as experience related to the unique issues related to the international adoption is hard, but very important. So you'll be looking for, probably, ideally, a licensed, experienced mental health provider with additional training and experience in the myriad of potential international adoption issues. For example, institutionalization, trauma, attachment, grief, abuse and neglect, FASD, and more. Many states offer postgraduate certificates to mental health professionals to help them understand the dynamics of adoption and to tailor treatment modalities to the needs of families and individuals affected by adoption. If you live in a state that has one of these programs, it is really helpful to take a look for somebody who has graduated from these programs, has this knowledge. It's also important to find a therapist with whom you feel comfortable working. Families must be able to share openly with potential mental health professionals that their family has an adoption history, and to inquire about the counselor's training and experience related to working with adoptive families and adopted persons. And the search for a therapist can also be complicated by insurance coverage and the therapist's ability to accept the insurance that you have. Some ideal qualities include licensed or accredited in your state, experience in working with children who were adopted and their families, knowledgeable about adoption, about the psychological impact of adoption on children and families, about the impact of trauma on children and families, about the role and impact of attachment on the mind and body for the developing child, and about adoption and children at different ages and stages of development, and about the types of therapeutic help and interventions available for adoption-related issues and problems. You're looking for a professional who has training in the mental health field and training in working with adoptive families, and ideally covered by your insurance. It takes time to find the right fit for your child and your family, but you need to devote the time that's necessary. The first step would be to identify the issues and problems that need to be addressed, and then research local mental health providers and their modes of treatment, methods, availability, goals, values, etc. Get feedback from other parents, and this is where FRUA can come in, through a Facebook group, gatherings with other families, other support groups, and Facebook groups. Feedback from other adoptive parents, other parents who have kids with similar issues, is invaluable. The next step might be to select 2 or more prospective mental health providers to begin the selection process and interview. And again, FRUA members will have access to more information about interviewing and selecting prospective therapists and counselors, as well as resources. So join FRUA so you can get these resources. There are a lot of types of treatment modalities and family support. There are a lot of therapeutic techniques, some of which have been around for years, others that have only recently been developed or made public, and even more appearing on the horizon all the time. Each method uses a little bit different approach, but they all share a common goal of trying to help clients change, grow, and alleviate problems. The type of therapy that you choose depends on a lot of different things: type and severity of the issues, age and developmental level of the client, experience, training, and preferences of the professional and the family. The slideshows and educational material available to FRUA members include a summary of the various types of counseling and types of psychotherapy and alternative and complementary therapies, various approaches to therapy, focuses on therapy, settings, networks, resources, precautions, and advisor contacts. And members will also have access to all of the future slideshows devoted to the details on many specific therapy modalities. Some of the types of therapy and counseling and support that FRUA plans to focus on in this series might include those listed here and more. There are various psychotherapies, talk therapy, that we will focus on in detail because a lot of our children are involved with these specific kinds of therapy. And at first glance, it looks like alphabet soup. There are differences, there are similarities, there are some that are better used for one kind of issue or another. And we will try to cover as much of that as we can. And then there are types of complementary, meaning therapies that are not specifically geared to psychotherapy and mental health issues, but can be used in combination with and can help some of the symptoms of these issues, or alternative therapies, ones that are not mainstream, maybe may not be universally accepted, but that some of our kids are using. So we will provide information on that. So thank you. Hope you have gained some insight from this brief slideshow, and please check out our website, and members check out more information at the MemberClick site. If you are not a member, please again, shamelessly asking for your support, become a member by clicking on the member link. If you have any questions or you can't get the member link to work, please contact info@frua.org, or you can contact me at education@frua.org. Thanks.